And I love this story. Some more good news. Yes, I am bringing you some good news. We did start off in a negative light, but I'm picking you up. We're picking you up here. So Lyft has begun to do something amazing for the people in California. So Lyft begins offering free rides to cancer patients in Los Angeles. I love the story. Speaks to me, baby. So those battling cancer in several U.S. cities, including Los Angeles, will be able to commute to and from treatment free of charge with Lyft. The company said this week the ride-hailing app is partnering with the American Cancer Society to operate the program, which is effective in L.A. immediately. Dan Witzling, executive director of the nonprofit, said in a news release that lack of transportation remains one of the largest roadblocks to those with the disease accessing quality health care. Cancer patients who need a ride can call 800-227-2345, and this is specifically for Los Angeles, remember. To coordinate with the American Cancer Society, the organization will then use Lyft concierge to book a ride. Those who use the service are advised to call a few days ahead of their appointment. Lyft said minors and those who need assistance walking should also be prepared to travel with an adult companion. So great news, Lyft. This is the kind of thing that's going to give you the hump over Uber. You guys have been doing a good job treating your employees better, paying them a little bit better. I know the competition is real between the two. I have many people in my family, many friends that do both ride Uber and Lyft. And I hear stories on both sides why one is better, but that's not the point of the story. The point of the story is to just clap it up for Lyft. Clap it up for Lyft. This is an amazing thing that they are doing, and this is continuous. And it's starting in LA. They said many cities, other cities are going to join sooner or later because it is a perfect thing. As a nurse, we know that patients that have chronic diseases, especially the kind of chronic diseases that need treatments like chemo, that need treatments like radiation, weekly, daily, monthly basis, it becomes an issue because the treatments, the disease process deteriorates these patients, so they're not able to drive, they're not able to function by themselves. Many of the times they do need help. And on top of that, if you leave everything for just the family to take care of, it makes it very difficult because having this disease process, being a cancer patient means number one, we all know that cancer is not a very cheap disease to have. If there was anything considered a cheap disease, I don't know if that's a thing here in the States, right? But it's a very expensive thing to do, right? So if you have cancer, the treatments are not cheap. The medications are definitely not cheap. So their caregivers, their caretakers are trying to take care of the financial end. They're trying to take care of everything in the home. They're trying to take care of the patient entirely. If this patient is the disease has taken too much from the patient, where they can't travel on their own, where they can't make their own, commute, it becomes a huge roadblock. So Lyft, thank you for doing this. I think it's amazing. You guys are awesome for doing this. Congrats, your mother-frickin-lations. Go Lyft.